Switch to the situation here at home, especially on health care. Senator Dodd, you're chairing the Health Committee in the Senate in the absence of Senator Kennedy. It got pretty heated there on Friday afternoon. Let me show our viewers a little bit of your exchange with Senator McCain.
I'll tell you, these hours have been a waste of time when we don't know what the bill costs, and we don't know what the employer mandates are, and we don't know what the government option is.
Can't run the numbers on it until we actually craft the language and give them something. So
they've run the numbers,
various ideas.
And it's $1 trillion with one-third insured.
Now, Senator Dodd, that was only a partial report by the Congressional Budget Office, but they did find it would cost $1 trillion, yet you'd only cover one-third of the uninsured, 16 million uninsured. Is that too high a price to pay?
Well, George, we're not done with this at all. You know, if this were easy, it would have been done decades ago. 60 years, the effort has been made to have a national health care program in this country, with almost 50 million uninsured, and those who are insured paying prices they can't afford and going to escalate every day. 14,000 people a day lose their health insurance in the United States. 14,000 a day. This is very hard. This is very difficult, but we're going to stick with it. We actually had a pretty good week in many ways. We did a lot of work. A lot of amendments were agreed to. You've had AARP come out in favor of a House plan. You have the pharmaceutical companies look like they're going to reduce some $50 billion in costs. We're moving ahead. Max Baucus is moving ahead. This is a difficult road. I'll be the first to admit it. Anybody who's been involved in this issue over the years will tell you that. But we're going to get there.
But Senator, bottom line, how much is this going to cost, and how many people are going to get covered? Because you talked about Senator Baucus, the Senate Finance Committee. They said to get to something close to universal coverage, it would be $1.6 trillion. A lot of people had sticker shock over that as well.
Yeah, and we all do. And look, we've got to make this accessible. We've got to make it a quality program. We've got to make sure we can bring down these costs. We can't consume 35 cents on every dollar as we could in the next 10 or 15, 20 years of our gross domestic product if we don't change this system, fundamentally alter it. That's what the effort here is all about. We're basically saying, look, if you like what you have, you can keep it. If you want, you choose your doctor, your hospital, your insurance coverage. That's fine. There's no one objecting to that whatsoever. But to focus on prevention, on quality, to disincentive a system where it rewards those who show up in hospitals and doctors' offices instead of trying to keep people healthy, that's the effort we're involved in here. And it's not easy to do this, but we're working at it. The numbers come back. We've got to obviously have better numbers than the ones we've seen, and we need to cover a lot more people than we're seeing. That's what we've been working on all weekend, in fact. But we'll work on again this week in the Health Committee.
Let me bring Senator Graham in on this. And Republicans seem to be digging in, Senator Graham, on a couple of big issues, on the issue of taxes to pay for health care and on the issue of a public health insurance plan. But let me show you this New York Times poll that's just out this morning showing 72% of the public supports a government health insurance plan, and 57% of the public is willing to pay more taxes for universal health care. They seem to be ready for the kind of changes that Republicans are fighting.
Well, it's just not Republicans, George. The reason you're not going to have a government-run health care pass the Senate is because it would be devastating for this country. The last thing in the world I think Democrats and Republicans are going to do at the end of the day is create a government-run health care system where you got a bureaucrat standing between the patient and the doctor. We've tried this model. People have tried this model in other countries. The first thing that happens, you have to wait for your care. And in socialized health care models, people have to wait longer to get care, and the government begins to cut back on what's available because of the cost explosion. The CBO estimates were a death blow to a government-run health care plan. The Finance Committee has abandoned that. We do need to deal with inflation in health care, private and public inflation, but we're not going to go down to the government-owned health care road in America, and I think that's the story of this week. There's been a bipartisan rejection of that.
Well, you call it a death blow. Let me just press that point. Are you saying now that Republicans, just as we saw in the stimulus, where only, I think, 3 Republicans voted for the president's stimulus package, if there's a government-run health insurance plan, are Republicans going to vote en masse against this package?
I don't think it's just going to be Republicans. You got Senator Conrad talking about a co-op. You've got other Democrats running away from the government-run health care where the bureaucrat stands between the doctor and the patient. I think this idea is unnerving to the members of the Senate, and it will be to the public when they understand what it means, that you'll wait longer to get treated and you'll get the health care the government decides for you, not that of your doctor. So yes, I think this idea needs to go away and replace it with something maybe like Kent Conrad's proposal.
Now, Senator Dodd, I think that, Senator Graham talked about the public there. We just saw that poll, but his read of the Senate seems pretty accurate. right now. You have not only Republicans, but several of your Democratic colleagues, including the chairman of the Senate Finance Committee, Senator Baucus, saying the public option isn't going to fly in their committee. They want something bipartisan, and that can include this public health insurance option.
Well, again, I'm delighted to hear Lindsey talk about the possibility of having something like a co-op. There have been nonprofits. I happen to support a public option. I don't think you can bring down cost without it. If there isn't some competition out there to drive down the overall cost, costs have gone up 86% since 1996, 45% in my state alone, increase in health care costs. The American average working family can't afford this. Family of four, now it's $12,000. We're being told in 20 years it could be half the gross income of a family spent on health care premiums. That is just unacceptable. Now, how we get those costs down, you use a lot of these buzzwords. No one I know is for socialized medicine. We're going to develop a U.S. plan, not a Canadian or UK plan, one that meets our needs in our country, that's designed for Americans by Americans, that isn't socialized medicine. But you've got to drive down these costs. We need quality, accessible health care, and bringing down those costs are absolutely critical, or we're going to bankrupt the country. It's unsustainable. That's why we're at the table. Okay, gentlemen, we're going to have you both back as this makes it through the process this summer. But Senator Dodd, before I let you go, real quickly, I see that Senator Kennedy is doing an ad for you up in Connecticut starting today. How's he doing? He's doing pretty well. I talked to him the other day, had a good conversation with him. In fact, the day we started the markup and the Help Committee on Health Care, he's been a champion of that for 4 decades, and he stays very engaged, very involved, knows everything that's going on, and is anxious to be back. And no one's more anxious for him to come back than I am. I'll bet. Senators, thank you both very much.